Your health is the most important thing you can invest in. Hey everyone, this is Dr. Brenden Cochran. Hope you're having a fantastic day. I wanted to give you a proactive health update. What is going on with the current situation going on? Well, we're not out of the woods yet. Two worse countries, still definitely better, but more plateaued versus logarithmically growing and still having cases every day is the United States and Brazil definitely lead the pack right now with total cases, total deaths, new cases. So, United States yesterday had 23,000 new cases. Brazil had 30,000 new cases. United States had 1,000 deaths, and Brazil is packing about 890 deaths. People that are up and coming, kind of Mexico is gaining some traction. You also have Russia, also very close to that. Total deaths per million of population. We see things like Spain, Belgium, and even Sweden at the top of that list, which is not a good strategy when you see the death rate that's high for those countries. So, what's accelerating that? Well, we're starting to mingle, we're starting to get up the economy open, and it's this balance, right? And some people don't believe in masks, and some people still think this is a hoax, and we also have these protests going on, which are creating large gatherings, which creates this dynamic for this to spread again. So, would not put it past me because we are seeing some trending up, some hot spots in the country since we've started to reopen. Remember, this lag time is about 3 to 4 weeks with people mingling before we actually see that because symptoms may not show up for up to 14 days. And then once the symptoms show up, then remember it takes another 5 to 14 days to show if it's really severe. And then it can take, in a good case, you get over it in 11 days or 14 days. In a bad case, like we saw some people from tracking the Princess Cruise Line where we had a nice control, some of those people were in critical situations for like a couple months. It was very bad for those people. Okay. Still have quite a bit of critical cases in the United States. We're pushing 17,000 that are in critical care right now, serious critical care. So this thing is not over by any means, and we still need to be protecting ourselves. I see some people are going to let their guard down, and we can't quite let our guard down yet. All right. Remember, your immune system is key to this, and protecting your immune system is absolutely key that you continue to go through this. We are having hot spots down in the south. We also have some hot spots up in the north in the Minnesota, Wisconsin area, seeing some upticks as well in those. And I would expect with everybody on top of each other like that, we're probably going to have some more upticks in this as well. Now, interestingly, some treatments that we could consider looking at. One of them is the Lancet's article with hydroxychloroquine and trying to squash that and saying, hey, it causes harm to people. It's coming under a lot of fire. One, because some of the authors in there have some financial conflicts. And two, because again, the study is lacking to look at zinc. It was also lacking to look at early stage versus late stage. If you compare that to the remdesivir study and you look at the late stage, you have two trials saying that it did nothing to reduce mortality in patients. So if we do that same thing and we're saying hydroxychloroquine has no help with reducing mortality, and then you have people even saying it increases mortality. However, that does make sense a little bit because this is a vascular disease and it maybe in the late stages could make that worse, right? And that's not how we've given that drug. We give it earlier. However, we've given this drug for 70 years for malaria, for prevention of malaria. And again, even in the definitions earlier with the WHO, cited no research suggesting that there was an increased risk of mortality with these, and the side effects were not severe. So the change of tune without backing valid research is just bull crap in my mind. And it means there's some people that are doing some very poor science and some political crap that needs to end. So we need to put it to the test. We really do. We need to take it early with zinc and see. We can't just shut all the trials down like they've done based on this one study with Lancet. That's the beauty of science. We have one group that says, no, it doesn't work. Then we have other groups that say it does work or it doesn't work. And if we get enough of those, then we can make an educated decision. And we also want to look at multiple variables when we're looking at multiple studies. That's how science really works, right? We don't just take the grain of salt with one study and say, you're awesome, we're going to follow your lead, and everything goes from there, right? So what we need to do, again, early on in the symptoms, give hydroxychloroquine, look at zinc, because again, Costa Rica, some of the countries that's their protocol, like Costa Rica, they have a very low mortality rate from this comparative to some of the others. So they're doing something right. We need to look at that further, right? Other stories I've heard from other doctors, what we've seen with some of our pharmacists, their feedback with patients, the people who were on it early had better outcomes than the people that waited 5 days in the symptoms and then got on it late. They're the ones that are having a rougher time getting through this. So really, we need to break that down. Now, there is no cure. We can't claim a cure. Even remdesivir is not a cure, guys. And the reason I point that out is because some people are making claims, which is wrong. However, also on the other side, our government and FTC and FDA are also coming at people, doctors, clinics, et cetera, making claims that you can't be putting out there that you're helping a person's immune system now. And they're overstretching their boundaries in my way, which is another reason we need to defund those two corporations and start fresh. We have some political gain going on that really needs a gut job, in my opinion. So with that, what else do we have that's very interesting that could be helpful? So we talked a little bit about this very early on, but we didn't really have a study on this. Early this month, basically a study was published using hyperbaric oxygen therapy in preventing the need for mechanical ventilation. Now, it was a small trial looking at people. So we do need a larger trial, but it did definitely say that people that did a standard dive, and they were at 2 atmospheres for 90 minutes, which is a pretty standard dive, So you could achieve this with a soft shell hyperbaric oxygen chamber. And these patients received, it looks like, 6 treatments, which really isn't a lot. We have patients that will do 30 to 60 to 90 treatments for some of their more chronic issues. And in this session, they basically said all the inflammatory markers dropped. The oxygen saturations also went up, which makes sense because you're pressurizing the system and delivering oxygen to the system. And therefore, it reduced the need for the last resort, which is mechanical ventilation. Remember, we talked about earlier, mechanical ventilation is a very bad idea to start with because it seemed to be increasing death rates if you did not pre-treat the patient with things like anticoagulants and antioxidants and whatnot, and waited until the very, very end, right, to do that. So hyperbarics definitely has an article here. Similar to what we see with ozone, because ozone does deliver extra oxygenation, and it has most of its research on supporting people with ischemic injuries, which this is a blood vessel disease, is what it looks like, that is leading to ischemic disease. So ozone could potentially be looked at as having a similar mechanism that would support a person like hyperbaric would as well. And that's why we saw some of the early things with Spain using ozone, and a lot of the case studies with some of the doctors like myself that have used ozone are reporting that they see benefits with patients who have this. Again, none of this is a cure. However, it is interesting to see different techniques that can be used to help wrangle this thing in. All right, guys, hope you like this content. Hit the share button or share this content, and we will try to keep you up to date at least once a week, maybe even twice a week if we have some very interesting things coming on. Keep yourselves protected still. I know it's getting old. I know the news is not covering it as much because the big bad protest and everything burning up is kind of taking over right now. But if you look at the facts, things are still brewing. It's not as sexy as it was, unfortunately, with the New York outbreak. But things are still going, so we need to be diligent so we don't backtrack too much. But we also want to keep moving forward with kind of opening things up safely. All right, have a great week. Talk to you soon. This is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.